Hi, I'm Jillian Silva, the owner of Tens for Labor and Austin Childbirth. As a childbirth educator and doula, I'm dedicated to empowering parents with knowledge and techniques to make their birthing experience as smooth and comfortable as possible. Every birth is unique, and my goal is to ensure mothers have a solid understanding of their options. One of the most effective tools I teach is the use of a TENS unit for labor. In many places like the UK, TENS units are commonly used for pain relief during childbirth, yet they're still new to many expectant parents in the US. TENS units work by sending gentle electrical pulses that help manage labor pain naturally. Whether you're planning an unmedicated birth or a wait-and-see approach, or maybe you've decided you want an epidural, using a TENS unit starting in early labor can be an excellent option for pain management. Did you know that 2/3 of your labor is considered early labor? I teach parents how to use TENS units safely and effectively so they'll feel confident in their choices. I hope you'll find this video helpful in making your decision about pain management during labor. So let's get started. So let's talk about a maternity versus a non-maternity TENS unit. So number one, the overall power of these little units is going to be more than if you were to purchase a unit, say, off of, Amazon, or perhaps pick one up at CVS. In fact, using these with our mamas in labor, we have never used the full capacity of the TENS unit even while mama's in the strongest parts of labor. So that's really important. Number two, the burst boost button. So in the regular mode, between contractions, you would have the unit in what we call burst mode, and that's how it starts up in the burst mode. And then when you have a contraction, you're going to press that boost button that you see there. I call it the magic boost button. And that's going to change the sensation and the intensity of the unit for the contraction. It's going to give you more of a boost, if you will, a stronger sensation, and it's not a waving in and out like the burst. It's more of a solid boost of pain relief that you're going to get. And when the contractions finish, you're going to release that boost button. It makes it so easy to use the unit. You don't have to turn a lot of dials up and down and adjust different dials. So this makes it super easy. And moms in labor don't want to think about things. They just want to get that pain relief. And so every time they have a contraction, they're going to press that boost button. Number three, the Optimax button. And this button is a great setting during the latter part of labor when the contractions really pick up. It's just going to give you even extra intensity when you press the boost button, and even in the burst mode, it's going to feel like more intense sensation. So it's just another, sort of power boost mode that you can use. And then we also have number four, which is the mode button. And again, that's going to change up the intensity of the unit. You can use this, like I said, in even the pushing stage of labor. It's going to give you extra power setting, and it's going to really help during those, latter parts of labor. Single channel versus a double channel. So what exactly does that mean? So the OB-TENS is what we call a single channel unit. And that means is when you have the pads on your back and you want to add more intensity, it's going to add intensity to all four pads. When you want to decrease the intensity, then again, it's going to affect all four pads. With a double channel unit, that means that you can independently control the upper set of pads and the lower set of pads. And that's handy because often I feel like mamas like to have more intensity on the bottom pads, especially as contractions begin to pick up in intensity. So let's compare the different TENS units available on our website. So we have the OB-TENS unit. This is a single channel unit. And then we have the L series. These are L1, the L2, and the L+. We'll go through these models and look at them, so it'll help you to decide which one that you would like to either rent or purchase. So we're looking at the OB10's unit. You can see that it's super simple to operate. You really basically have an on-off button. You do have the boost burst mode, and you have the single channel unit with the up and down button for intensity. So like I had mentioned previously, when you turn up the intensity on this unit, it affects all 4 pads, and so the intensity is going to increase in all 4 pads. When you decrease the intensity, it's going to go down on all 4 pads. And like I had mentioned earlier, some mothers do prefer being able to adjust that power and having more power on the bottom pads as her labor progresses. And with that said, I will tell you that, some people just really like the simplicity of the OB10s. So there's nothing wrong with the unit at all. It can be a great option. It just depends on if you feel strongly about having more power on the top or the bottom pads. So this is our L10's unit. And this particular unit does have 2 channels. So what that means is, again, you can increase or decrease the intensity in either the top set of pads or the bottom set of pads. We're going to talk about the pad placement, so you'll see all this in just a minute. So just hang tight on that. But let's just talk about the other options that this particular unit has. So in addition to the the intensity buttons, the plus and the minus buttons, it also has in the middle a mode button, as you can see, and it always starts up in mode 1. And mode 1 is used in the earlier stages of labor. And then mode 2 can be used in the latter stages of labor. When your labor is picking up in intensity, that mode button gives a little bit of a different, more intense bursting mode and the boost mode as well. And then in addition to that, it also has what we call the Optimax button. And that's at the top there where it says OM. And this gives sort of extra pain relieving power in the stronger stages of labor. That's, of course, when you need that the most. So it's going to give you different options to be able to change up the mode. And that's really important with a TENS unit, because as we wear a TENS unit, our body begins to adapt. Our brain begins to tell us that it's not perhaps as strong as it was in the beginning. So being able to turn up the intensity as our contractions get stronger as well can be really important. So that's why it's so nice to be able to have the options of using the Optimax or the Mode 2 setting. So this is the L10's 2. And the main difference between the L10's 1 and the L10's 2 is that the L10's 2 has a backlight. So you can see that amber color there on the screen. And it's nice to have that light because, during labor, often I find that mums like to have the room sort of dark and, get it maybe into the mood. So a dark room, maybe some soft music playing and candles going. All those can be nice things to have during labor. So if she wants to look at the TENS unit and on that screen in particular, she's able to do that a little bit easier because of that backlight. And the one thing that I love about the L10's 2 is the contraction timer. This is wonderful. And the reason I like it so much is because this makes it super simple for mom to time her contractions. So whenever she turns the unit on, we know it's in burst mode. And the next, so she's got her unit on, she's just put it on, and now she has a contraction. So she's going to press the boost button. When she presses that boost button, that activates the contraction timer. And what it does is it tells the time between contractions, and it also records the time of the contraction. And it does keep a history of that. So if you press the channel 1 and the channel 2 button together, that is going to display the history of the contractions. So it makes it super simple for her to time her contractions just by pressing that boost button when the contraction starts. So that's one thing that I absolutely love about the L10's 2. So this is the L10s Plus, our Mac Daddy of units here. And the difference between the L10s Plus and the L10s 1 and 2 is that in addition to all the things that we were just talking about, this unit also has a pelvic floor toner, as you can see there on the left. And this is something that you can use once you are 12 weeks postpartum. It is a vaginal probe that will help with pelvic floor toning. It has special settings in the unit for pelvic toning, and it has several different toning programs that you can set. So it can be a really helpful, unit after you have had your baby. Of course, in addition to that, it has the regular birth mode that you would see in the other L10s units. And then it also has a pain mode. So it has the pelvic floor mode, a birth mode, and a pain mode. And the pain mode is just an ordinary sort of relief from a TENS unit, because I always tell people, you're going to find that TENS unit, even after you've had your baby, really helpful. You can use it during the postpartum period. If you've had a cesarean section and you're, sore down in that area, you can put 2 pads down on underneath and on top of, not on top of, but at the top and underneath where your incision is, and you can have your TENS unit going, and it can be really helpful just to provide some pain relief to you. And I can tell you this, my husband pulls his back a lot, he strains it, and so he gets that TENS unit out and puts it on his back. So it can be used for a variety of things. So even after you've had your baby, you'll probably still find that a TENS unit is really helpful. So let's talk about electrode pads. So a couple of things first, just reminding you that the Baby Care TENS electrodes are recommended, and if you do use another brand, it will void out the warranty on your TENS unit, so just a word of caution there. And then also the use and care of the pads, so they can be reused for the same person about 10 or 15 times. So you want to make sure that you look after the pads, and that means that when you're not using them, keeping them on that special backing sheet, and in the packet there's a Ziploc as well on that packet there, so it keeps them from air getting in there, so it helps to prolong the use of them. And also, it's recommended that when you place the pads on the area, on the back, you want to make sure that that area on the back is free of any oils. So you can either use soap and water and make sure it's dry, or you could use alcohol prep pads. Works very well. And then they should last quite a few times. So that way you're able to practice using your TENS unit once you're 37 weeks pregnant. You can actually start practicing with your TENS unit, and then also you can obviously use them during your labor. So what about the placement of the electrode pads? So you can see there that with this mama here, she has got 2 pads at the top and 2 pads at the bottom. The top pads want to go about underneath where your bra strap would be. And then you can see on each pad there's a red connector and a black connector. So that would make up the top set of pads. And then on the bottom, you want to make sure that you place those pads about where the gluteal cleft is, or another word for that would be your butt crack. You want the bottom of those pads to be lined up there. And in the diagram, it shows those wires facing down on the bottom set of pads. I actually prefer to face them up so that all the wires, or both connectors meet in the middle there, kind of at the waistline. So, I mean, it's really up to you. It's not the end of the world if they're done like this, but I find it a little bit easier if you face those bottom wires upwards than downwards like they're showing. And obviously you want to make sure that you keep the pads about 1 inch on either side of the spine. And then what's going to happen is those connectors are going to plug into the lead wire, the purple lead wire. And then remember, on the OB10s unit, you've just got the 1 lead wire, even though you have 4 connectors. And then on the L10s units, you have actually 2 lead wires. So you're going to have a set that goes into 1 lead wire, and then the other set of electrodes go into the other. And then remember, on the L10 series, we have 2 channels. So that means that the top pads and the bottom pads can be controlled independently. Because remember, we mentioned that often mums like more intensity in the bottom set of pads. So how does a TENS unit work? Well, if we look at the gate control theory of pain, what that tells us is that our spinal cord contains a neural gate, if you will, and that modulates the flow of pain signals. So when the gates open, those signals can pass through and it'll be sent to the brain and perceived as pain. When the gate is closed, pain signals are blocked or reduced and you experience less or no pain. So a perfect example of how the gate control theory of pain works, if you've ever jammed or slammed your finger into a door, and I'm probably guessing that you have done that, the first thing that you do is just immediately take it out of the door and you rub it vigorously with your other hand. And that really does help to make it feel better, right? If you stop rubbing it, you feel that pain again, so you rub it some more. That's a great example of the gate control theory of pain at work. That's exactly how it works for you during labor. The electrode pad is producing a very mild electrical stimulation right under the skin that sends that signal to the brain, and it's a more pleasurable signal, just like rubbing your finger, and that helps to alleviate some of that pain, or, in some cases really blocks or even reduces a lot of the pain from the contraction. The other way that it works is by the release of endorphins. So we know when we go into labor, our body produces a lot of endorphins. And when you add a TENS unit to that, it's going to even increase those endorphins. So that's a great reason to start your TENS in early labor. In fact, I really can't emphasize that enough. As soon as you go into labor, you want to get your TENS unit on. And that's because if you wait until your contractions are really strong and you introduce the sensation of the TENS unit, which at that point, you're really going to have to crank it up high for it to work with the contractions that you're having at that point, it just sometimes doesn't feel good at all. So the whole idea is you want to start it in early labor. This gives a chance for your body to get used to the TENS unit. And as your contractions are getting stronger, you're increasing the intensity of that TENS unit. And it works beautifully. Let's go over the contraindications to using a TENS unit. So you wouldn't want to use a TENS unit in water. If you do want to get in a tub or a shower, you just want to make sure that you remove the TENS unit and the pads. And then, of course, once you're back out of the water, then you can resume with the TENS unit after drying off really well. I will tell you that we've had several clients that have worn a TENS unit during their labor and decided that they wanted to get in the shower or a birthing tub. And so we took the unit off and then they got in the shower or the birthing tub and literally within 5 minutes they're like, I want to get back out and get the TENS on. So I find that very interesting. I think it's really just because they were very used to what the TENS was feeling like for them. Not to say anything negative about getting in the water. I think that can be a great thing to do while you are in labor. But I think just the fact that they were used to having the TENS unit on and then taking it off was very strange for them. You wouldn't want to use a TENS before 37 weeks pregnancy. So, you are welcome to use it after 37 weeks, but just not before. Good idea to get familiar with it, practice with it. If you have backache, it can be excellent for that. You can't use a TENS if you have a pacemaker or if you have epilepsy. And then, of course, if you have any skin irritations in the area where the pads will go, you wouldn't want to use a TENS unit. So those are the contraindications. I just think it was really important to just go over those before we wrap things up. You can purchase or rent a TENS unit on tensforlabor.com. So those are the options you have, as well as obviously the different models available. The rentals are for 6 weeks. Obviously, I give you a bit more time than that if you need it, but I usually like to get it back within about 6 weeks if possible. And when you rent a TENS unit, you are going to get the unit You're going to get the box that it comes in, obviously, and you are going to get a return prepaid label, so it makes it so easy for you to send the unit back. So you just want to, after you've used the unit, you're going to put it back in the box, and you're going to seal up that box with the return label that's included, and also a sticky label to actually seal the box. If I don't get that TENS unit back 90 days after your rental, so in other words, from the day that you started your rental, you have 90 days to get that unit back to me. If for some reason you decide that you just love it so much and you want to keep it, or you just forget because you've, got a new baby and a lot of things going on, then you would be charged a $75 fee, and now you will be the proud owner of a TENS unit. So we do have rentals available, and then we have the 4 models available for purchase. It's totally up to you. Some people like to rent a unit and not have to bother about having to have more clutter around. And then some people like the idea of having their own TENS unit. Perhaps you're planning on more children later on, or you just like to have your own unit. So it's totally up to you. The unit itself, if you purchase it, is guaranteed for a year against any manufacturer defects, so just know that. And obviously, we do recommend that you have to use, if for that guarantee to be in effect, you do need to use our electrode pads, which are available on the website as well. Well, I hope you have found this little video helpful, and I hope it's answered some questions for you. And of course, I really want to emphasize, and I can't do so enough, that you do want to start that TENS unit in early labor. Ideally, the sooner the better. Once you are 37 weeks pregnant, you can start practicing with the TENS unit, and I encourage you to do that. It'll get yourself familiar with how it operates, and it'll also get yourself familiar on how it feels. And if you're experiencing any kind of backache at that point, which often at that point of pregnancy we are, you'll feel that you'll probably benefit from using that TENS unit. So once you're 37 weeks, go ahead and start practicing with it. And if you have any other questions or clarifications, please don't hesitate to reach out to me. I'm here for you, and I hope this video is really helpful.